Most of you have probably heard of the anecdotes in patients with multiple sclerosis being treated with venous angioplasty, mostly from the Italian literature. And Dr. Meissner is going to break this down and see if it's a real syndrome or not.
Thanks, Jose. I have no disclosures for this talk. Well, a relationship between impaired cerebrospinal venous drainage and multiple sclerosis was initially proposed by Paolo Zamboni 2 to 3 years ago, based upon a combination of these 5 ultrasound and transcranial Doppler findings. As shown here, he was able to identify a population with a very high incidence of extracranial venous stenoses. As you can see in the table, these findings were consistently found in patients with multiple sclerosis and were virtually never found in controls. And using criteria for cerebrospinal venous insufficiency of 2 out of 5 of these, identified a population with an incidence of azygous stenosis of 86% and internal jugular stenosis of 91%. All of these were confirmed on venography, and in contrast, no lesions were found in the 48 controls undergoing venography. And the pathophysiology of this has evolved, and this is very similar to what Joe Raffetto just showed you for venous ulceration. We get venous hypertension arising from extracranial stenoses, which are in both the azygous and the internal jugular vein distribution, with venous reflux and decreased shear, leading to white cell and endothelial activation with leukocyte activation, adhesion, and migration, extravasation of blood cells and protein with resultant inflammation, and in the end we see perivenous iron deposition and fibrin cuffing in MS, which is known to be a venocentric disease with the classic plaques occurring perivenously. The Italian group subsequently did an unblinded, non-randomized series of 65 patients who were identified using transcranial Doppler and duplex. Unfortunately, compression of the brain really doesn't work very well, so fortunately these patients didn't have to go through the insurance company with compression first, but went directly to angioplasty. And you can see the durability of this was somewhat limited, only about 50% in the internal jugular vein, although it was substantially better for the azygous vein. Sustained improvement wasn't seen in patients with primary or secondary MS, but patients with relapsing remitting MS had a decreased incidence of relapses and improvement in lesions on MRI, as well as quality of life and composite measures of function. Well, there have been several criticisms of this, and this has been probably one of the more controversial areas in neurology and vascular surgery, as well as interventional radiology over the last 2 years. These are nicely summarized here. First and